Hello all, welcome to today's class on psychological assessments. Today we have three major agendas to discuss. First is to know what is a psychological test. Second is to understand what are the uses of psychological test, and the third is to how to select a psychological test. To come to the first agenda of what is a psychological test, according to Susan Arbinia, a psychological test is a systematic procedure for obtaining samples of behavior relevant to cognitive, affective or interpersonal functioning, and for scoring and evaluating those samples according to standards. So, if we are going to take a break of all the important things in this definition, we can see that first of all, a psychological test is a systematic procedure where there are a way in which we administer the test. There is a standardized procedure and we take a sample of the behavior, especially that which are related to the cognitive aspects such as judgment, it could be intelligence, problem solving skills, and affective such as trying to understand the mood of an individual, the anxiety levels or the interpersonal functioning, and also for scoring and evaluating these assessments in accordance to the norms that have been created for these assessments. We have come across varieties of tools. What the tools that are not fitting into these criteria, for example, instruments whose responses are neither evaluated nor scored as right or wrong or pass or fail, are generally called as inventories, questionnaires, surveys, checklists, schedules or projective techniques. And these tools are generally put under the rubric of what is called as a personality test. So, when we talk about personality tests are generally classified into three major types. One is a subjective assessment where we conduct a detailed interview to understand about the particular personality. The second is an objective assessment, the world's most widely used way of understanding a person's personality. It is through objective kind of questions that are given to the person, which we are having as a primary point of discussion today. And the third is the most fancied one, the projective techniques, where we have a variety of methods where we show certain type of cards and we expect them to project their internal desires and needs as a part of their personality assessments. Coming to the uses of psychological test, we know psychological test has a variety of uses. So, one of the most common use of a psychological test is for us to have a decision making. For example, we are stuck at a point where we are not able to understand what is exactly happening with that individual. So, we need to take the next step, and psychological assessments would give us a way. When we are stuck with not able to give a particular diagnosis, psychological assessments can give us a specific answer for what that person is undergoing right now. And the next most important use is in psychological researches. We need a standardized way in which we assess the person's personality or any factors. So, psychological assessments are used in all sorts of psychological researches to create a standardized basis. And third, where we all do for self-understanding. So, self-understanding is nothing but trying to get more clarity about who I am. Most of them, they come into a psychologist's office to understand what is going on, what is wrong with me, sometimes just to know what I am made of, what should I improve upon. For those purposes also psychological assessments could be used. And the final and the most important use is to generate a treatment plan, especially when we are talking about clients who are diagnosed with various disorders such as anxiety, depression. Various tools can give us a baseline of where we have started from and how the treatment has been very effective. And also at times it can give us a particular plan in which we need to proceed with that particular individual, whether we need to focus on the somatic symptoms or we have to focus on certain other areas of his life, which would be the primary objective of the test. So, these are some of the uses of psychological assessments, but these psychological assessments could not be very useful if you are not selecting them appropriately. The selection of the psychological test becomes very important. There are varieties of factors that can influence what kind of personality test that we are selecting. For example, one of the most important factor that can determine is the usefulness in answering the referral question. Most of the cases that we get are based on a referral. So when a person is referred to us for some kind of assessment, we need to look into their referral question. For example, a child who is having a problem in a school with his academics, constantly not able to perform properly. So this is the referral question with which he has come. So right now, we can think about certain assessments based on the referral question on what has to be done. Whether we are going to check the academic scholastic skill of the child, or we are going to check the intellectual quotient of the child, or is there anything else that is disturbing the child from preparing or presenting well during the classes. So first factor is the usefulness in answering the referral question. Second is based on the client's presenting problem or need. Not necessarily every time we'll get as a referral for psychological assessment. Sometime during the therapies, we might have come up with certain presenting problems which we are not able to exactly classify, and for this purpose a test selection could be very useful. So based on what is exactly going on, and for us to plan ahead based on the need of the client, we can generally go for the test we need. The third is very important because it talks about the training, experience and the personal preferences and the familiarity of the assessment with the particular person who is administering it. Because if you are not trained well enough to administer a particular test, or if you are not having, even if you are trained, if you are not having enough experience to administer it, and if it is not your first personal preference to do it, or if you are not very familiar with the scoring procedures, then it is not the best tool to select. For example, an individual who has been referred, for example, we might have to go for let's say selecting Rorschach as a first hand tool, but my training is not in Rorschach. I have not been trained in the certain scoring methods of Rorschach. I am not experienced enough in Rorschach, and my personal preference would have been any other assessment than Rorschach. But since the referral question specifically asked for a projective assessment, if I had chosen Rorschach, then I might not be the best person to talk about that particular assessment. So the training, experience, personal preference and familiarity with the assessment would become a very important criteria for what test we are going to select. The next important thing is the practical efficiency in the terms of time and economy, because we also should look into how long a client can stay with us, how long will they be ready to spend time. There are certain assessments which can take a couple of hours to administer. There are certain assessments which can take less than 10 minutes to administer, and the scoring procedures can be different. So depending upon the time and the economical aspects, we can select certain assessments. And these days, to help us, there are a lot of computer assisted instruments that has come up. For example, MMPI has Minnesota Multiphasic Personality Inventory, has its own computer version where it is enough if you are giving the particular responses that has been entered by the client, and the scoring would be done and a report would be generated based on the scoring that has been done. And the last and most important thing is the dimension of the psychological test, because it becomes very important what we are trying to assess. Sometimes it would be the state, sometimes it would be a trait. So we need to know whether we are assessing a current state, that is what is currently disturbing the individual, or a long-standing trait, that is something which has been there from him since his birth and that we are going to assess. For example, a depression could be both a state as well as a trait. So we need to know what is to be assessed, a trait or a state. Depending upon that, we need to change the tool. For example, if you are going to assess the state of depression, we can administer a Beck's depression inventory or a depression inventory by Hamilton. If we are going to assess the trait of a depression, then it is better we go for Minnesota Multiphasic Personality Inventory, which talks about depressive traits. And another factor is the norm category, because this becomes one of the basic and elementary things, because we need to look into whom the particular assessment is fit for. For example, Millen's clinical multi-axial inventory would not be eligible for a person who is less than 18 years. So we need to look into all these norm categories before we get into the assessment. Coming to one of the most important things, two special concerns in selecting a test. One is called faking tools. Certain assessments gives us an opportunity to have something called a faking scores. So MCMI gives us a validity scale and a fake scale. So MCMI also does the same, which gives us a validity and an inconsistency scale. So these things will help us to understand whether the client has taken the test seriously or not. And one more thing is to use short forms, generally not as a replacement, but wherever possible, to make sure we are administering it in quick time, and in a repeated measure if you want to do, using of short forms is generally encouraged. And that would be all for today, and these are some further readings which you can do for